Madame Halima Jacob, President of the Republic of Singapore, Minister Gan Kim Yong, Your Excellency, distinguished guests, ladies and gentlemen, colleagues and friends, we are very honored today to be launching the book titled Resilient and People-Centered Health Systems, Progress, Challenges, and Future Directions in Asia. And to do so among such distinguished guests, and also some of the authors of the book are here today with us, and also some of the people that made the book possible. The book has been a collaboration between the Asia-Pacific Observatory on Health System, as well as the International Council of the School of Medicine, and we have some of the members today with us also, and the National University Health System in Singapore, led by Professor Yon Wong. The book emerged through a discussion in one of our Raffle Dialogue committee meetings, when we thought that it would be a good idea to try to bring together national, regional, and world experts to conduct a health systems assessment in Asia and to explore both opportunities and challenges. It started the discussion last January. Only in late March, I agreed to take on the project. So, as you can imagine, it has been a race against the clock. And we wanted to have the book today for you. So we've been working non-stop, and we are very, very honored, and if you don't mind me saying, very happy to be able to have the final book today with us. For those that like to travel light, we also have a pen drive, because I know some of you only go with little bags, so you have a pen drive or you have the book there on a PDF. I have to say that this book is a collaboration among 50 researchers and reviewers in 13 different countries. We wanted to include some of the senior leaders in global health in the region, and some of us are here with us today, Professor Tiki Pang, Dr. Yon Wong, Dr. Suan To, but very importantly, we also wanted to include the new generation of leaders, hopefully. So some of them are also here with us. Melissa Tan is here, and Julia Spencer, and Renzo Ginto from the Philippines. This book represents an example of what we want to highlight and foster in the Raffles Dialogue, an example of collaboration within ASEAN countries, but also going beyond Asia and globally. I have to say that we were also very pleased that the editor-in-chief of The Lancet mentioned the book already twice in the previous session, not once, but twice. Some of you came to me afterwards and asked me, did you pay him anything to praise the book? I have to promise I didn't.
I did.
As you will see, the book is structured in two parts. We have 4 cross-sectional chapters that look at the governance for health. We also have a chapter on planetary health, which it has been discussed in today's session by Helen Clark and also in the previous session. And then we have 2 chapters on how to tackle NCDs and infectious diseases. Then the second part provides evidence in the form of case studies from a selection of countries comprising Cambodia, Indonesia, Japan, the Philippines, of course, Singapore, Sri Lanka, and Thailand. I want to highlight only a couple of things in terms of the content of the book. A recurrent theme of the book is that people should be at the center of the health system. People health systems promote equity, compassion, dignity, and respect. And the book suggests that strong patient and community involvement is crucial. And we especially emphasize the importance of taking into account vulnerable groups, such as migrant populations and refugees. You will see in the title that we've put in capital letters, progress. Of course, we talk about the challenges, but we also wanted to highlight the very good progress that is already happening in the region. And for that, we don't need to look too far. In Singapore, it's one of the key examples of people-centeredness health systems where the different regional health systems have put people, patients, and healthcare professionals at the center. And today we already heard from Minister Gan Kim-yong that the key point is to empower our patients, you've mentioned this in the previous session, our citizens, and to move healthcare to the community. Before I hand over to Nima, who will present the conclusions of the book, I want to thank a few people. First of all, Ms. Su Mei Lee, who is there at the back, for managing the book very efficiently. And I also want to thank those who agreed to write the foreword for the book. First of all, I want to thank Professor Yap Seng for his vision of the book, Professor John Wong for his continuous support and encouragement throughout the process, Professor K1 also for his support, and our Dean of the School of Public Health, Professor YY, for always encouraging us to do global health work. I would like to do a special thanks, and this is a bit emotional for me now. Some of you may know that one of my mentors before moving to Singapore was Professor Peter Piot, the director of the London School of Hygiene and Tropical Medicine, who is today with us in the audience. And I want to thank him for his continuous mentorship and for giving me the opportunity to be part of a couple of big projects, Lancet commissions, that in turn gave me the confidence to take on projects such as this one. So thanks a lot. So in conclusion, I just wanted to highlight that this has been a real team effort, and we really hope that this publication will be a catalyst for future collaboration among various institutions in Asia. We hope this book will be a resource for policymakers, academics, students, practitioners throughout and beyond Asia, and will provide better insight and evidence for enhancing policy decisions, ultimately to help advance health and well-being in Asia's populations. Many thanks for your attention, and now I hand over to Nima for his remarks. I thank you.
Thank you, Helena. I am going to start to talk a little bit about APO, but before that, I want to say, Madam Jakob, President of the Republic, Minister Gan Kim-yong, the Minister of Health, Excellencies, distinguished guests, ladies and gentlemen, it is indeed an honor for me to be here to such a distinguished gathering to talk about the challenges that the book identified and to use this situation as a way of pushing forward further collaboration between the academics and the policymakers across Asia. APO, the Asia-Pacific Observatory, is hosted by WHO, but it is a partnership which fundamentally works between academics and policymakers in Asia. In fact, back in 2011, when it was created, it was Singapore, along with governments of Hong Kong, Thailand, Philippines, and South Korea, which came together with ADB, World Bank, and WHO to create this partnership with the mandate of generating evidence from Asia for Asia, and pushing that evidence to policymakers, and at the same time trying to increase the capacity to do that kind of research in the middle-income countries in Asia. So it's with that mandate that I'm going to highlight the challenges that the book identified. And I also want to thank Richard for priming everybody to those challenges so that we can work on those issues further. So the first thing that came up as a challenge was the need for an integrated approach. Integrated approach which is not just horizontal between health and social care and the wider issues, but also vertical between primary, secondary, and tertiary, with the emphasis being on primary health care. At the same time acknowledging that the hospital sector is an important partner when it comes to health, especially as we are moving towards a more chronic situation which will have acute and chronic exacerbation. The second thing that came up as a challenge was sustainable health financing. If you want to have universal health coverage in the countries in the region, we have to put the money into the system. And it has to be not just for curative services. It's just as important to include health promotion and health prevention issues when it comes to sustainable financing for UHC. And the book brings out examples from different parts of the region on how they are doing that. The third issue that came up is the golden nugget of health workers, having the right people at the right place with the right skill set, doing the right thing. And what we want to highlight is that there is a need for paradigm shift. To do that, there are challenges which has to deal with entrenched viewpoints of the professional communities about their own roles. And that could mean looking not just on postgraduate training, but actually highlighting undergraduate training, on teamwork, on working together when it comes to developing the next generation of healthcare workers across all of the various fields, as well as looking at other factors such as task shifting. Fourthly, if we are going to embrace no one left behind, that means for not forgetting vulnerable populations, such as cross-border or inter-country displaced people, migrants, and refugees. I mean, if you're saying that health is a human rights issue, then that includes everybody in a particular country. And that in itself actually makes economic sense when you look at the whole of the country's economy. At the end of the day, providing support irrespective of race, gender, color, age is necessary if you want to manage some of the more entrenched health issues. The fifth challenge which came up was mentioned many times already in the morning session, in the afternoon session, is to do with the use of innovations and embracing new technologies and innovations, not just about introducing new products or new commodities, but much more about processes, looking at exploring innovation of services, integrating services across different areas, across different levels, improving effectiveness and maximizing efficiencies in the health system. An area which not many people are looking into at the moment would be the use of big data for health service, and also looking at how health need, if at all, to regulate the interactions with big data, which does have implications for the health sector. And finally, talking about planetary health and globalization issues, the last challenge that was identified was health is a fabric of the society. So it's important to work with different players that influence it. Globalization, climate change, role of the for-profit private sector, they're all part of the matrix that we need to be cognizant of. And it's important for the health sector to be part of that dialogue when it comes to other issues, to put in the impact and also the positive aspects that health can provide when it comes to those issues. This, in a nutshell, is the summary, but please, the books are outside, waiting to be grabbed, PDF format, as well as the hard copy. I would like to end by conveying also my deepest gratitude and thanks to our partners who provided the funding for us to actually write, develop, publish the book. That is, of course, the NUS Medicine International Council, as well as the NUHS. And certainly from the APO side, I look also forward to working collaboratively with you and other partners in the future. And thank you very much again for your attention. Please enjoy your dinner. Thank you.